Okay, we're going to do some trach care on Mrs. Smith. So before I entered the patient's room, I made sure I reviewed her chart, if there's any complications or anything, and then gather my supplies. I'm going to need a sterile suctioning kit, any PPE that I need, probably a face mask. I'm going to get a trach care kit. Also make sure I have a resuscitation bag and some sterile saline syringes. Also, I want to make sure I have a trach oxygen mask so we can hyperoxygenate our patient. So I'll go ahead and enter the room. Knock, knock. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory care team here at the hospital. Today we're going to do some trach care, okay? So that always needs to happen at least twice a day. We'll need to communicate with the nurses to make sure it's getting done. Make sure I'm going to set up my suction canister here on the wall, and then I'm going to assess my patient. I'm going to listen to her breath sounds, check her SpO2, and then I'm going to check her cuff pressure here, making sure it's in between 20 and 30. And then we'll go ahead and start. We're going to start off doing a sterile technique of suctioning. So we'll have our open up the gloves. I'll have one clean hand, one sterile hand, put on those gloves, and making sure I only touch the catheter with the sterile hand. Then I will get some lube, put it on my right hand here. I can also hyperoxygenate Mrs. Smith while I'm doing this. I'm going to hook up the suction to the wall, and I'm going to go ahead and insert the catheter here and make sure she's suctioned out. Okay, Mrs. Smith, we're going to go ahead and insert the catheter. Feel a little resistance there. Pull back a little bit and go ahead and include my thumb hole and suction. Okay, we can that in the sterile box here, and we'll hyperoxygenate to Mrs. Smith. And now we can go ahead and start the trach cleaning. Go ahead and put this down, put on my PPE if I need anything, a face mask, and we're going to go ahead and untie the trach here. We can always hold it down and take out the inner cannula. If it is a disposable inner cannula, like this one here says do not clean or reuse, so we will just toss that. If we did need to clean it with a reusable one, we can go ahead. Our trach cleaning kit has pipettes. We could clean it out in a basin that we have here with some saline. And then we'll set it on. There's some gauze that comes in here. We can let that dry. So then we'll go ahead and take out the gauze or foam pad, whatever's underneath, and we can use another saline syringe, and we're going to start cleaning the stoma site. So I'm going to make sure I'm holding down the flange here, and I'm going to start from the inner part and work my way outward. Each swipe I'm going to toss my Q-tip. Getting a new Q-tip, I'm going to clean that side as well, doing the same to the opposite side. Now I'll make sure that everything is dry. I'll have my new gauze here that I can put on. Okay, I'll tie down, put new ties on there, and I will make sure that Mrs. Smith is comfortable, that she doesn't need anything. I will make sure I replace the inner cannula. Listen to Mrs. Smith's breath sounds, check her SpO2, and check this cuff pressure to make sure it maintained, it didn't loosen up or anything while we were cleaning. Sit Mrs. Smith in a comfortable position, make sure she has her call light, low locked bed, and that's it.